welcome to good afternoon and welcome again. It's our repeat focus on Facebook Live. I'm Hussein Kermali, Chief Medical Officer here at St. Mary's Hospital. Again, each month we highlight a specific service line here at St. Mary's Hospital and giving you some insights into the service and options that are available for our patients here at St. Mary's Hospital and within the Greater Waterbury community. And so today, I'm very happy and excited to welcome Dr. Stefan Kachala. He is our new Chief of Thoracic Surgery. And thank you very much for joining us today.
Thank you, Dr. Kamala.
And in the short period of time we have right now, I'd like to go through, talk a little bit about yourself, and then focus back over to your specialty, thoracic surgery, what that is and what it means for our patients going forward.
Absolutely.
So welcome and thank you very much for joining us.
My pleasure.
So thoracic surgery, different from general surgery, a little bit more specific. Give us a little bit of background on what that is.
So it's a surgical discipline of the chest. Essentially, everything within the chest to the exclusion, in my practice, of the heart and great vessels, meaning that no cardiovascular procedures in terms of my area of expertise. Strong focus in surgical oncology, that is diseases such as lung cancer and esophageal cancer, form the kind of bedrock of the type of cases that I perform, but also many benign diseases as well.
Okay. So let's talk about your story. Let's go back a couple of years, because one of the things I found interesting was your first degree was a degree in molecular biology.
Yes.
And that must be why we get along, because my first degree was in molecular biology as well. So does that relate to the course of studying, thoracic surgery or diseases related to the chest, or how did that relationship come into
So I think just an excellent insight and question that really started my journey towards medicine and surgery to begin with. I actually came in as an undergraduate thinking I was going to be a physics professor. That rapidly dwindled because I realized it didn't have the person-to-person interaction that I really craved at that point. And the reason for molecular biology, I saw it as a method of kind of asking questions about cancer. Where does it come from? How does it develop? How does it affect the overall person? And then, what are some aspects of trying to treat it as well? I've spent about 6 years in various laboratories, both from an undergraduate perspective when I was a medical student at the NIH, and then finally when I was a surgical trainee, I spent 2 years in a laboratory at Memorial Sloan Kettering.
Wow, that's fantastic, especially how it relates to the cancer. Because as you and I are both aware, and I'm sure a lot of the members of our viewing audience, the molecular piece of cancer is sort of the new pathway for therapies these days as well.
Really, having an understanding of the genetic makeup, the molecular markers are really key to not only understanding that patient's biology, but determining what is the best therapy for that patient. And it's such a critical part of oncologic care today.
Yeah. And so not only that, but your field is also transforming into the robotics and the robotic surgery. Yes. That we're hearing a lot about. Give us a little bit of insight from that.
So in terms of the field of thoracic surgery, one of the things that drew me to it is this desire for ongoing innovation. My mentor, Dr. Valerie Ruch, she is actually starting to step down as the head of the Department of Thoracic Surgery, Memorial Sloan Kettering, from a vice chair of research position. What drew me to the field was her example. She was, I was drawn to surgical oncology. I felt that I just didn't know what discipline. And because of her just excellence as a teacher, skill in the operating room, but ultimately it was her compassion for her patients, really it was her humanity, something I aspired every day. And that's what drew me into thoracic surgery. Mm-hmm. In her being one of my mentors and spending time at Memorial Sloan Kettering, it was really revealed to me how much we really need to innovate. So a constant desire to bring the best to our patient, ask new questions. So how robotic surgery came into that was how are we pushing the field in terms of advancing the care, achieving the best oncologic outcomes, that is the best cancer therapy with the best surgical therapy as well. And so it's pretty clear to me today that the evidence supports its adoption. When I came out of training, had an excellent training experience at the Cleveland Clinic, but a minimal amount of exposure to robotics. So when I started, I really felt this is where I have to set myself apart, but then offer something new to the citizens of Connecticut. And so in the last 5 years, really going whole hog, so to speak, into developing that skill set. So now I'm really able to offer a full robotics platform to my patients.
And that's amazing, because one of the things that caught my ear was that you're relating it to patient care. And I'm a huge proponent of patient care, and how it defines their experience in the hospital. It's not always about which needle or which machine, but it's how did they feel and how was their experience along the way. So connect those two pieces, the robotic surgery and the patient care. How do those two pieces connect?
So if we're not advancing the care, there's no reason to adopt new technologies. And I think medicine in general and surgery absolutely is full of people who thought that some new move was going to end up being the new way we were going to treat patients, and it never bore out in the evidence. Perhaps increase the cost, but sometimes increase the complications and poor outcomes of those patients.
Sure.
Robotic surgery is borne out differently. And I think the main things we see is the ability to have perhaps achieving the same things we can do with open surgery, but in a minimally invasive platform. Have less pain for those patients, so a more rapid recovery. Less pain has so many downstream effects in terms of being able to mobilize faster, cough and deep breathe. All those things decrease the rates of complications, things that keep the patient in the hospital longer. So then we have a decreased length of stay as well. Ultimately, if these are performed on a consistent basis, we can then offer surgery to patients who perhaps would have been, we would say, not surgical candidates, mainly due to their comorbid conditions, which increase their perioperative morbidity, meaning that they had a high chance of having a complication that would have very severe consequences for them. So now with robotic surgery, we can kind of offer patients in a safe, appropriate fashion procedures that perhaps they weren't candidates for before.
And that really changes the landscape, because often, even myself as a hospitalist, we talk to patients inside the hospital, say, sorry, there's nothing we could do for you. But now that has changed, and that there are options that you're able to provide for them.
It really changes, like you just said, the whole landscape, mainly because, when we think of patients who are frail, it used to be simply age. Age is no longer a single determinant. It's usually associated with other factors. People are generally more frail as they're older. But I have had patients who are 84 years of age who are incredibly spry, are taking good care of themselves, and are asking me, why am I being excluded based on my age alone? And we have to take a good hard look at those other comorbid factors. On the other hand, I've also had patients in their 50s that have perhaps made some choices that result in a much harder living lifestyle that perhaps you have to simply counsel them. They think that because of their age, they would be safer for surgery, but in the very case, their comorbid conditions actually make them higher risk. Robotic surgery is kind of a great equalizer that allows you to offer surgery with decreased complication rate and helping them, again, get them back on. But if you can't achieve the best care, then it's not worth pursuing. Not luckily, the evidence supports using robotic surgery in those cases.
And that's great. I know our robotics team downstairs in the operating room is operating at a very high rate.
Absolutely.
We've got 2 robots downstairs right now that you guys are using. Could you give us a little bit of a description of the robot? People think robot, I think transformer, but that's just who I grew up with.
Yeah.
But tell us a little bit about the robot compared to what people might think of, when we say minimally invasive surgery, and how's the robot a little different?
Well, I think first, if it was a true transformer, having Optimus Prime in the operating room would be a little intimidating. He's pretty big. So when we think of robotic surgery, it's really facilitating the skill and complexity of the procedures we do with a large traditional approach, but rather through small incisions and cameras. So the robot does appear to be perhaps a little arachnoid in type, with these long spindly arms coming off a central pillar, and in a separate corner connected by a fiber optic cable is the console, wherein the surgeon can control those robotic arms, which are typically less than 8 millimeters in diameter, to an incredibly fine degree, perhaps even finer than the surgeon's own hands could be in the patient. And the reason for that is the computer software controls for any tremors or minute fluctuations in the motor action of the surgeon and translate into a much smoother, more precise action by the robot. So a constant kind of, and it also, ergonomically, the surgeon is sitting in a much more relaxed posture, so there's less chance for the surgeon to become fatigued, has higher degree of concentration, and can focus on that procedure for a longer period of time. And essentially, the surgeon is always in the room next to the patient, and we typically place the console, because the surgeon's eyes are focused in the console looking within the patient, to a degree that if he simply lifts his head, he'll be looking directly at the patient and his assistant team at the bedside.
Right.
So the surgeon's performing the entire operation through the robotic instrumentation.
And then for the patient, they're just having less pain, less incisions, and faster recovery.
Correct. That ultimately, the impact of the robotic care is to achieve the same outcomes, but afford them through means that allows a faster recovery.
Fascinating, and thank you very much for bringing what you're going to continue to grow here in the Waterbury market. So let's talk about how the patient connects to you, because normally it's not the patient who's calling you, but it's one of their doctors. So let's talk about some of the services you provide and the different specialties that connect to you.
So I work most closely with oncology and pulmonology. Oncology in terms of partnering with the thoracic surgical oncologic care for lung cancer, esophageal cancer. Ultimately, primary care providers who identify some of these presentations. I'm very accessible,
Yes.
always willing to provide my cell phone number
Yeah.
for a discussion before the patient even comes into my clinic. Finally, other surgeons, partnering with them, perhaps provide exposure or work together on larger, more involved cases. My colleagues in radiology, as well as gastroenterology. Again, nowadays we really have to be part of a multidisciplinary team,
Yeah.
so we can kind of take care of patients and making sure with those open line of communications, there are no barriers to that patient's care.
And so it's an exciting time here, particularly as we advance in GI, which we've talked about here on Focus on Facebook, our advances in some of the other areas around the chest and how they're connecting with you. It's really amazing to see this vision continuing to grow. What do you see as vision for future in thoracic surgery?
So in the short term, really bringing everything to bear in terms of identifying lesions earlier. We have a push within Trinity Health of New England, specifically in the Waterbury area with St. Mary's, of really codifying the lung cancer screening program to provide that early identification of new lesions, so that identifying patients with, unfortunately, late stage lung cancer is a thing of the past. The data has shown that those early screening studies afford patients to have it early identified, thus affording them the potential for a surgical cure. So that's the one thing, being able to provide that service here. Next, a more tailored approach. Providing these bronchoscopic methods will also provide additional tissue. So even if those patients are not surgical candidates, we can provide enough specimen so the oncologist has the ability to genetically analyze that tissue, to provide those test results, those molecular markers, to be able to be targeted and customize that therapy to the patient. Finally, working together with my colleagues to overall bring to bear a kind of platform here at St. Mary's Hospital where the patient doesn't have to leave the area to have the kind of excellent thoracic surgical that they require. Ultimately, compassionate and convenient care would be kind of my goals there.
And I know Waterbury is one of those areas in Connecticut that wants to be able to have their care right here, and thankfully we're able to provide that. And I think about it not just as a nice thing to have for patients, but the support system that's built around them already. Their friends, their family, the comfort of their own home, the not having to travel back and forth on the highway to follow up. Those are big pieces of the puzzle.
They really are, and they're not really quantified in terms of their impact. I think overall, when we think of as physicians, when the tables are turned on us and we become the patients, what do we want? We want those exact things.
Yeah.
We want to be able to reach out and touch our doctors. We want to know that if I have that safety net of my friends and family and just local community there, it ends up being a better impact for us. That neighbor who can come and check up on me, make sure that I'm eating enough after surgery, I'm getting mobilized. Hey, I haven't heard from my neighbor in a while. Those kind of things, I think, ultimately help support the patient's recovery and care and engender just a greater healthcare community for Waterbury.
And we're looking forward to continuing to roll that out. One piece I want to connect on, one of the last two pieces, is new technologies. So, and you and I have spoken about this, but what can we anticipate here at St. Mary's as far as new technologies, new possibilities?
So in the short term, in terms of our discussions about what is the kind of the new technology we can immediately bring to bear with the greatest impact. Alluding back to the screening procedures, there's a kind of robotic bronchoscopic technology that's being employed on various platforms. And I'm excited that, with your help, we're being able to bring it here to St. Mary's. It's the Monarch system. Essentially, it allows a safer, better patient experience to get that diagnosis at an earlier stage. So ostensibly, one day, a patient could have a CAT scan that identifies that nodule, and in the same day, we could diagnose the cancer, stage the cancer, and treat the cancer in a single sitting. So that the time from identification to treatment identification, diagnosis, and then being cancer-free, that's really kind of an ultimate marker of cancer care quality, and narrowing that gap is an ultimate goal of myself, and I know of St. Mary's under your leadership.
It would be wonderful for us to deliver unfortunate bad news and then good news on the same day.
Absolutely.
It's almost like what our goal is in medicine. Unfortunate, but here's what we're going to do, and then do it. Last piece for our viewers, let's give them a tip. Screening for these types of things, who should get screened, what age should they get screened, and a red flag marker for I need to see a doctor today, not tomorrow.
So I'll give you two red flag markers.
Okay.
The first one is if you're smoking, please seek help and assistance to get off of cigarettes. It's really the ultimate thing that we know can make the greatest impact in your life. Now, linking to smoking, if you're a smoker over the age of 50 and have smoked for at least 20 years, you are a candidate under the current rules to undergo lung cancer screening, an annual CT scan of the chest, low-dose radiation that can be performed either by your primary care provider, your pulmonologist, or even you can contact one of the local radiology groups and they'll help facilitate that for you.
Correct.
With regards to other cancers, such as esophageal cancer, having trouble swallowing, at any time if you experience weight loss, that is a very large red flag. Now, there are other reasons to lose weight, whether intentionally, but I'm speaking to unintentional weight loss, difficulty swallowing. Those are reasons to really seek out a physician with all haste. But I'm going to simplify it a lot. There's a lot of things that we overlook in our own life, signs and symptoms. If you don't have a primary care physician, if you're not getting your regular screening, whether it's for breast cancer, colon cancer, these things mean that you're missing out on opportunities to improve your health overall. There's so many factors that we overlook because we don't think we have the big things, but generally, if you're worried about something, you need to get that checked out. There's tons of red flags we could go over that are really scary, that are related to things like coughing up blood, a cough that won't go away, as we alluded to, the weight loss and swallowing. But ultimately, we want to make sure we're taking care of the whole person. So getting plugged in and finding a physician to help coordinate that care for you is of utmost importance.
Thank you very much, Dr. Kachala. I really appreciate the advice and the discussion today, and look forward to continuing to build the program here in Waterbury.
It's been my pleasure. Thank you for having me.
Thank you very much. Have a great day.
You too.
Take care. Thank you all. We'll see you next time.